Now, more of our coverage on the coronavirus pandemic. The Delta variant is now forcing a growing number of people to rethink their international travel plans. This comes as countries are reopening their borders to Americans. Canada did so today, allowing Americans in for the first time in a year and a half, all while the CDC is adding 16 countries to its very high COVID-19 risk level.
Should you stay or should you go? The Delta variant triggering changes in travel restrictions and health measures, making some travelers rethink their upcoming international trips.
There are still lots of hoops to jump through. If you're vaccinated, if you wear a mask indoors and eat outdoors, you can manage your risk and make the best decision for yourself.
Not long after countries in Europe, the UK, and others announced reopening plans and lifted restrictions, some have had to pivot, bringing back testing requirements.
Even if you're vaccinated, you still need to take a test within 3 days of coming back to the U.S. I do know people who have had those tests delayed. God forbid you test positive abroad. Depending on the country, you may even need to go into a mandatory hotel quarantine.
On Monday, Canada reopened its borders, allowing fully vaccinated Americans in for the first time since March 2020.
Canada, they're going to be vigilant about checking those vaccines. You still have to get tested.
This comes as the U.S. Centers for Disease Control and Prevention added 16 destinations to its very high COVID-19 risk level, including Greece, Ireland, and the U.S. Virgin Islands.
It's kind of interesting because the CDC has that level 4 warning for a lot of countries that actually are handling COVID a lot better than the U.S.
And the CDC has placed Canada at level 3 high for COVID-19. Level 4 is the highest warning. They also say that people should be fully vaccinated before visiting other countries as well as other locations within the U.S.